I recall the first time that I noticed vision changes was when I was in the kitchen and I was looking through the kitchen windows. It seemed that there was a bow in the vertical lines, and that being in my line of work, working with ophthalmologists, obviously something wasn't right. I did kind of a check, a 1 or a 2, if I was noticing it with both eyes, or I wasn't sure if that was just because maybe I was sleepy, but I was not necessarily concerned until more time went by and it did not go away. If it wasn't for the wavy vision, I probably would not know that I had a brain tumor to this day. Once I was able to get in to see my ophthalmologist, she notified me saying that I had swollen optic nerves. She told me to go see a neuro-ophthalmologist. We went to the ER to get the MRI testing done fairly quickly. When I looked at the screen after the MRI, it was almost as if I had a third lobe. It was about the size of a mango, which is quite large.
I got a phone call from Dr. Glenn Harper, a neurosurgeon in the Round Rock area, and he let me know that he had a very complicated case, which is what I specialize in. In her particular case, it ended up being an intraventricular meningioma, which is kind of rare. These are typically benign tumors, but the complexity was that it was very deep-seated in the brain. You could see on the MRIs that it had huge blood vessels swirling through it, so that made it a very challenging case. By the time she was getting to my clinic, it was very clear that she was going to need surgery because this is going to become life-threatening very soon.
I was diagnosed with the brain tumor on Monday. I met with Dr. Ashura on Tuesday, and I had brain surgery on Wednesday. We told my son Jeremy that mommy was sick and that she was going to have to go to the doctor. I know that oftentimes patients with complex cases have to travel to larger cities like Dallas or Houston, but I never felt like I was going to need to go outside of the city in order to get the care that I needed. It made a huge difference for me and my family.
So in these very large tumors, it's a combination of two techniques. We had to do an angiogram, which is a blood vessel study, and map out the blood supply to have a roadmap for the surgery. Once we achieved that, in her particular case, we were able to take our catheters, which are small tubes, right into the blood vessels leading to the tumor and inject a very high-level substance to remove that blood supply. And then it allowed us, at the time of surgery, to be able to cut directly into the tumor and remove it in the way that we would like to. In Jasmine's case, she's young, and so we're not trying to just solve the problem for the next 6 months or the next year. We're trying to solve this problem for her lifetime without significant neurological complications.
I was in the hospital for a total of 13 days. Most of the time I was in the ICU. The care that I received in the hospital was incredible. I really loved all my nurses in the ICU. They really helped me get me mobile, getting that peripheral vision to come back. I felt that they were truly invested in regards to my recovery and helping me get back on my feet from day one. Top of the line, honestly. And I think that Dr. Ashura, I think that he really goes above and beyond for the care of his patients.
The future of neurosurgery, to me, is trying to look outside of what we're currently doing to make it better for the patients. I think that in brain surgery, we're kind of oftentimes seen as the final frontier because doing treatments in the brain is risky. So there's a lot of technologies that we need to tap into, but they have to be made specific for the brain. I think many tumors are going to be able to be treated without surgery, and I think that would be, that's ultimately our goal.
I honestly feel like I'm fully recovered. What I can do now is essentially the same thing as before surgery. I don't feel like there's anything that I can't do anymore. Being able to hang out with my 3-year-old Jeremy, he's full of energy and it takes a lot to be able to keep up with him. Having to go through brain surgery, I don't feel like I had anything taken away.
Except for a big tumor.
Except for a brain tumor, yes, absolutely.